Hi, it's Dr. Robert Davis with Active Health Complete Relief Care. I am back answering your frequently asked questions regarding Trigenics and the procedures and therapies we offer in the office. The next question I have is, how can Trigenics help someone with migraine headaches? Well, migraine headaches can be debilitating. Sometimes it forces people into a secluded room in the dark, and they can get these headaches multiple times a day. It takes away from their quality of life. It takes away from their family and relationships. So it is quite a reward when I can help someone with migraine headaches. So your brain is controlling everything, like the computer sister master control center that is controlling you. For everything in your body to work properly, you have power up in the brain. It sends signals down the spinal cord and it runs across the nerves. So your head is operated by muscles. So in order for you to flex your head forward or extend your head back, to rotate your head, to take your ear and put it on your shoulder or put it on your other shoulder, there's many different movements. They're all controlled by muscles. Well, the muscles are controlled by the nerves. So just like the case of a frozen shoulder, where muscles are not lengthening or strengthening properly, the same thing happens with the neck muscles. So if you have constant miscommunication across these network of nerves, and I'll just highlight a couple of these here, that are running up into your head, running along the neck muscles, you're going to have an issue where things are just going to seize up. And by restoring that communication, muscles will lengthen when they should and strengthen when they should. So people that have migraine headaches, there's a tremendous amount of pressure in this area because all the bones have muscles attached to them. So if muscles are tightening when they should lengthen, or they're lengthening when they should tighten, well, that very important structure inside those bones that the bones are there to protect, now that spinal cord inside and those nerves, now you have pressure on that very important system. And then you get a situation where you have noxious, abnormal signals going across the network. So people can have all kinds of different issues with ears, eyes, nose, throat, because they're static in the lines. So that's in short. I can go into more detail in the future, but basically what is happening is that you have a miscommunication across the network up in this area here that controls all the muscles around the spine, and you have lengthening when the muscles should be strengthening and strengthening when the muscles should lengthen. It causes direct pressure on the nervous system in this area. It will also cause an issue when you have that tension up here, the lack of blood flow coming from the heart going up to the head. So then you have a situation where you don't have proper blood flow. So when I work on somebody with Trigenics, we get a complete release of the nervous tension and also the tension on the vascular system, so the blood flow restores immediately. If you or a loved one are suffering with migraine headaches, I encourage you to give us a call. We'll do a full neurological evaluation. I'll do a thermography scan. We will also do a digital posture analysis, so I can show you how this forward head posture actually causes the spinal cord to go in the wrong position. It puts a tremendous amount of tension up in the area where the brain becomes the spinal cord in this area. So you have the brain stem and then the spinal cord. So instead of having a nice curve, people lose their curve and there's choking pressure up in this area. And again, ears, eyes, nose, throat, many different things can be affected in that area. Thank you very much for listening. We look forward to meeting you. God bless you.